So welcome, everybody. I think we'll go ahead and begin. I know that there are others, especially our QI scholars, that will be joining us, but we do have less than an hour because of another meeting. So I think that we will start. And I'm Marilyn Hockenberry, and I want to welcome all of you to this Writing the Best Abstract for SIOP Nursing. And keep in mind that some of the things we'll talk about are really relevant to any abstract that you might be writing for other congresses, but I really want to focus on our SIOP nursing abstract, and I hope all of you are either writing an abstract or working with somebody that is going to be writing an abstract. So let's jump in. And what I'm going to do today is really talk about the SIOP abstract guidelines specifically to present principles of abstract writing that I think that will really help you as you begin to focus your writing, to review the components of the abstract submission itself, and then talk about examples of abstract sections that we'll review specifically. So just a few words. Let's start by talking about our SIOP admission, and it's all online. You can either put in SIOP Amsterdam and come right to this, or you can actually, I put the login here, the website right there you see listed in the red box. But one of the big takeaways of this is to go to that and read the abstract submission and guidelines section, because it tells you explicitly, it's a very well organized abstract submissions session here that tells you exactly what to do. And I think some of the key things, I'm not going to read them all, but I want to point out a couple things in that you must be in person to present. All oral or poster presenters. Make sure you know that. There is an e-poster viewing that can be by virtual participants. The other thing to know is you cannot miss the deadline. You can't expect the day later saying, oh, I forgot to submit. You have to have these in by midnight CET on April the 1st. The other things I commonly get questions about is previous publications of an abstract. If you have submitted something, but it's not yet accepted, you are still eligible as long as it hasn't been accepted by April 1st. So if you have something in and in March this month, you hear that it's been accepted, it wouldn't be eligible. So make sure that you know that as well. And the other one is the common question is that if I have presented elsewhere, can I still submit this to SIOP? And the real key here, they've made it very clear. If you've presented at a smaller Congress, say SIOP Africa, where there was less than 500 people there, or a regional conference, as long as it isn't a large conference, less than 500 attendees, you can submit your abstract again. The other thing in this site, and I won't spend a long time on it because it's in great detail in this wonderful submission site, but make sure that you have all of these things ready. You'll need, if you have co-authors, you'll need to make sure that you have their emails and their place of institution of employment. Make sure you have these things ready. Look at your abstract title. Follow these guidelines. A big, huge guideline is it's limited to 300 words. And the nice part of that is now, because it's electronic, it does tell you if you are over words. So that will help you. But make sure before, and we're going to talk a lot about this, make sure before you submit that you have everything very refined. The list of topics I'm going to talk about in a minute for nursing, and then the 4 key things that are part of your abstract that we'll talk about as we go through how to develop it is background and aims, methods, results, and conclusions. Here are the 4 categories for nursing abstracts. You will be asked to select one of these: education, research, quality improvement, or baseline nursing standards. So make sure you go to the nursing ASO4 category, and then you'll choose one of those. If you're from a low or middle income country, when submitting your abstract, and you haven't had a nursing scholarship to attend a SIOP conference in the past 3 years, and that's key for you to look at, then you are eligible if you're from a LMIC. And then what I want you to make sure you do is check that box requesting a scholarship. And that's really important for those of you in low and middle income countries. And that's right on within your abstract submission form. There will be a spot for you to do that. I wanted to say a couple more words about the baseline standards because I want to, especially for our nurses submitting abstracts from low and middle income countries, and for some of our fellows that are on from our scholars from our QI Scholars Program, is that go to the website for baseline nursing standards, and here's the log on for that within SIOP, and look at the different categories for baseline standards, and you see them here. And if you think your abstract fits that, do submit it as baseline standards, because some of our QI projects and some of our education projects for low and middle income countries could really fit within these categories. So I really want to advertise that this year. I want you to look at that carefully because we really like to have baseline standards abstracts, and I think some of your abstracts may fit there. So just a plug for you to consider that category as well. So let's jump into then how do I organize? I'm really excited. I have a project, I have done something on my unit, or I'm working on my master's. I have a research thesis that I'd like to write up, or I don't even know what my idea is, but I know I want to be challenged to write an abstract. Where do good ideas come from? Well, really, the best ideas come from brainstorming and collaboration. Very few abstracts come in with just one sole author, because, as you know, most of the projects that you're a part of are very much from a team-based approach. And so, what you want to do is really brainstorm with others to think about what did we do best this year, for example, on the unit? What's our favorite project? I like the chance favors the connected mind. When more minds come together, you really have a better chance of having something good develop. So keep that in mind of brainstorming with each other and collaborating with each other to come up with the best topic. The key piece of writing an abstract, and this is even true for manuscripts, is what's the interest and what's the impact it could have on the population that are going to be, one, reviewing your abstracts, and then if you're selected, listening to your presentations. Is it interesting? Is it novel? Is it exciting? If it's been done before, are you doing a better methodology than other studies in the area that's been published before? Does it have the potential to create significant impact? Sometimes ideas are great, but it's really not feasible, for example, or it really doesn't pertain to our particular area of specialty. So think a lot about what is most interesting, what is most exciting. And I always tell students to start with thinking about what are you most passionate about? What are you most excited about in your own nursing care? And look at that. And many of our projects are because of that, of our passion. And so make sure that you have that novel, exciting edge to your specific topic that you're going to write about. So for the SIOP abstracts and many other abstracts from congresses, here's sort of the 5 key points that we're going to go over: the title of your abstract, the introduction, the methods, then the results, and then the conclusion. And the greatest advice I can give you is don't deviate from these instructions. I have seen in the last several years abstracts that come in that have nothing to do with these categories, and I'm like, were they trying to be creative? Don't be so creative that you really lose points in your evaluation of your abstract. So when we review those and there is a nursing abstract committee that 3 people individually, each abstract gets reviewed by 3 people. We look at these categories and we make sure that we score based on what you have in these categories. So don't deviate. I'm going to go into these categories in great detail for some examples. So how do you begin to put your thoughts into words? And these are I've read this in previous writing um, publications before, and I really like it that within these categories, you start to just put words together. Don't even think about organization, but what do you want to say in your introduction? And just kind of write like a madman. And then you begin to structure and say, and we'll talk about this. Oh, this doesn't go into methods. This might go into results. And you start to categorize the things that you're writing about in the sentences or even just notes and concepts. You start to put them together like an architect. And then your next step is you've got to get it to 300 words. And what I see is most people have way over 300 words, and then you have to carpenter it. You have to start, really editing and pulling things together like that. And then the last phase is to judge and to have others read your abstract and have others that give you feedback on things that you might do better. And again, we'll talk about this in more detail. So let's start with the title. The title is the face of your abstract. And I love this huge long list by Tulu that you see here of what your abstract should be. And that's almost overwhelming before you even start writing the meat of your abstract. But it should be simple and direct and accurate and appropriate and interesting and on and on and on. I think it tells you how important your title is. And sometimes we don't pay much attention to that. And some kind of words of wisdom is to don't make it, you have 25 words, but that's a long title. The better titles are more short and accurate that really tell me what you've done, but don't go on and on and on. So, what you'd like to do is basically be interesting. Don't also be too cutesy. Remember, this is a professional Congress, so you don't want to have something that's so cute that you'll really be marked down on. You do get scored on your title, so you want to look at that. What I recommend, I also don't like colons. A lot of times you'll have, a certain section in the colon and on and on and on. I would try to keep it without doing that. Try to make it interesting. The other thing to make sure you do with your title as you look at this long list of things is it should match what you say in your introduction, your methods, your results, and your conclusion. And I'll often go back to the title when I'm reviewing your abstracts and say, well, the title didn't have anything else to do with the body of the paper. And that is something you don't want to red flag your reviewers to be taking you, down in points because your title might have been, not like what you see Tulu examining. So let's go on to introduction. So the introduction really sets the stage for what you are going to be talking about. So it's really the basis of your study. It's a project that's clearly stated. It tells you about the rationale of why you're doing this study or this baseline standards project, education, or QI. And then you want to have something clearly stated about the aims or the objectives or their hypotheses. And this is where I see people getting into trouble with research that might have taken you 2 to 3 years to do, or even a long-term QI project, is you want to put everything in because you love everything you've done. You can't, in 300 words, talk about a study that has 3 hypotheses or 4 aims or 5 objectives. Sometimes you want to pick one and just focus this presentation on one, and then the next year or the next conference, take another one. So usually I recommend one statement at the end of your very short introduction that tells an overall aim or an overall objective. But don't try to put 3 smart aims or 4 hypotheses in a very short 300-word uh, abstract. And so throughout this, I'm going to show you some different things that can help you see how focused you can be with your introduction. The other thing I do is I do word counts as I'm writing and brainstorming. I do word count on introduction, methods, my results, and my conclusion. I kind of like to have 50 to 70 words in the introduction, use more of my words for my methods and results, maybe 100, 90 to 100 there, and then 50 words for the conclusion. And so I use that as I'm evaluating and helping others as well, because it keeps you in the context of not having 700 words to go through. So this is a 56-word introduction. In sub-Saharan Africa, There is no standardized approach to pediatric palliative care assessment. There's a critical demand for evidence-based assessment tools that identify specialized needs of children and their families requiring palliative care in developing countries. The aim of this project was to develop a standardized approach to pediatric palliative care assessment in sub-Saharan Africa. So you see exactly the reason why there's no standard approach, what we're doing, and what we're hoping to accomplish in this project. So short and sweet, but no doubt about the population, what specifics in palliative care, that's an assessment tool we want to implement, and we want to standardize our approach to care assessment. So with methods, let's move on to methods. These are really important area to make sure you've clearly described what you did. And so how I like to see the difference between methods and results is methods is what you did. Results is what you found. And so often, many abstracts that come in for SIOP nursing have these mixed. And you see the results in the methods, and you see the methods in the results. Keep it clean like this, that in methods, you're just telling us what you did. In results, you're telling us much more about what you found. So if it's a research study, what we hope to see there in just a few sentences is your design. What was your sampling methods? What was your sample, your procedures, your instruments, and even a couple words about how you analyze your data. When it's a QI education baseline standard project, it's a little more subjective because you're doing such different things based on what the title of your abstract is, what your introduction is. You got to be specific and make sure it aligns with that, the focus of this particular abstract. So you may talk about a tool. You certainly want to introduce your project or your program that you're implementing. What was your target audience? What were your evaluation strategies? What were the methods? And with that, as you'll see, if the big target was just developing an education program, there's much less discussion in the methods about who those people were that took the program than if you're going to talk about, baseline orientation nursing program with 25 nurses on your unit. You're going to talk much more about them. So keep it focused. If it's developing a program, you're going to talk more in your methods about how you did that. If it's working with new nurses, you're going to talk more about them. And it's keep going back to the introduction and your title to make sure they're all consistent. So I'll just show you a few words. This is a pure research one on symptom experiences some years ago from my work. Symptom trajectories of 236 children with leukemia, 3 to 18 years of age, were explored prospectively using standardized instruments over 4 treatment time periods, and you see them listed. Then I say latent growth analysis was used to classify patients into distinctive groups with similar symptom trajectories based on patients' response patterns to the symptom measures over time. And with that, I had 63 words. And so it really tells you who the population is, how many, their age. I use standardized instruments. You see the time periods. And you see what analysis. The only thing I think is missing here is it would have been nice for me to have a sentence about what symptoms were actually looked at over time. But you see, again, sort of the organization in very few words that tells you exactly what this research was about. So look at this one that's an education program. It also could be a baseline standards because this was in a low-income country. What you have to do is decide which category you want to submit to, but I really wanted to showcase some of these to show you that there are 2 options for some of the abstracts that you guys are going to be preparing. A nursing curriculum was developed to teach the basic principles of nursing care for children with cancers. 2 courses included short video lectures, readings, critical thinking activities, and case studies. Common types of childhood cancer and essential components of nursing care are presented. Key is an extensive understanding of chemotherapy included in the curriculum, and that goes on to talk about how they can take the course either online, download it, on their own personal computers or take it from notebooks they can check out. And then I also added that they can meet by Zoom or WhatsApp. And then competency examinations are completed, and once passed, certificates are given. So in 98 words, I've really told you what this education program is all about. And as you see the focus, as I said here earlier, the focus on this one was much more about the education curriculum development rather than, the real details of the nurses. Now, in results, if you would see this whole abstract, and again, I'm giving you different pieces of different abstracts, you would see that we talked about who's completed it so far and the success in that. But you are the author of your abstract. And so you have the decisions to make of what kind of emphasis and focus. Again, keeping it interesting, keeping it something that can be, make the difference in cutting edge and really help those reviewers know that you have something really unique to say. This is another one, quality improvement, that also could be a baseline standards. If it's in the evidence-based practice category, this is about peripheral intravenous access, extravasation. You see here, using the PDS cycle, the plan for practice change was based on evidence from published research and established PIVC care guidelines. Change strategies were developed and nurses completed education on proper PIVC insertion, dressing placement, and ongoing PIVC assessment. Proper dressing procedures using semi-transparent dressings to allow visualization of the PIVC were implemented. Nurses learned the touch, look, and compare method to assure that PIVC was intact, and standardized times for site assessment. So you can see in 75 words, we have told you what the methods were for this QI project and how we implemented it, and then more importantly, what we did. And another words of wisdom, so many times I see abstracts and they don't tell you what they did. And I'm also often writing back to some of you, I think even on the course class today, give me some details, put some meat in here that draws that reviewer's interest into this abstract would really make a good presentation. Because think about it, what you're doing with your abstract as you submit it in is you're convincing the reviewers of these abstracts first that you really have something interesting to present at Congress. So think about the nitty-gritty details that a reviewer would say, oh, this is a good extravasation QI project. Think about the details that you want to put in that. And then your results, another major, I think, key area that sometimes we see the most points taken off of, in that we don't see actual results or numbers. Spend time on this again, 75 to 90, 5 words in this area to give you the details that you need to discuss. So your results really depend on what your project is. If it's a research study, it may be purely quantitative, or it might be a mixed methods. If it's an education study or QI or baseline standards, you may have more quantitative data, but you also may have interviews and things like that. So make sure your data is presented clear, it's precise. If you're doing research, sometimes confidence intervals over p-values are better, but it really depends on you and your level of sophistication. The big thing here, back to I'm saying, if you have a really huge project, you've got to select a very small piece of it. Don't try to put 3 years of research into an 85-word results section. Keep it very concise. Pick one theme, pick one aim. If it's qualitative, we like to see what themes or categories came out of the data. If you're doing mixed, you need to make sure you have some kind of sentence that shows how you use both. Very few do systematic reviews for abstracts, but if you do, make sure it's clear how you got to those search results and how you got to the actual articles or the reviews that you are presenting on. And then if you have the QI or education or even your baseline standards, you still need to have some data there about your evaluation, because if it's an abstract and you don't have any results, it's really not going to weigh well in the reviewing phase. So make sure you have something. If it's a pre and post, if it's qualitative interviews on changes in practice from perceptions, anything there, you have to have some data to show that your project made a difference. And that's where you stop and think for a moment. What were the differences? What did I see that changed? And that goes into your results section. So research pretty straightforward. Here's one from some of our symptom work. I won't read it all, but here you see, I tell you about the number of patients, their age, they completed symptom questionnaires. I told you how long, over 5 days. And then I did some descriptives of telling you what the most common symptoms were. And then, some of the differences based on the prevalence of the symptoms, and that some of them decreased over 5, but interesting, nausea did not. So within 75 words, I've given you a pretty good understanding that this research abstract is about nausea, pain, fatigue, and multiple symptoms. And I've kept it very concise throughout everything. The title matches this, the introduction. Don't try to throw other things in there that you might have explored, but if you're not talking about them in this abstract, don't put them in. That's one of the biggest things that advice I can give you. Keep it very concise and very consistent. Here's one that's an education one results section that also depending, this could be a baseline standards because it is in a low income country. It could be on continuing education, but this is during the first 17 months of implementation. These were education seminars, echo seminars. We showed you how many participants total that we had from 18 countries with an average of 35 participants each time. You see that we had people from our own site, but we also had 56% from community hospitals and schools of nursing. And then we ended with, an evaluation that they felt they were more confident, and they also felt like this case-based learning approach we used in these seminars was extremely successful. So any education abstract really should have something about the evaluation of the participants, where there was an improvement in scores, like a pre and post, or was it improvement in confidence, or was it an improvement in just, feeling more excited about what they had heard and that it was extremely successful, what they participated in. And you see I have 67 words there, so I have some words to continue working on this abstract. Just one more back to the decreasing peripheral intravenous catheter extravasation could go in as quality improvement, but it also could fit evidence-based practice because this was the development and implementation of a guideline for PIVC care. But here we see pre-data assessment, where we actually found a high incidence of extravasation. We looked at a prevalence measurement prior to the practice change. We found 32% of 37 children had extravasation evidence. We also look at how many attempts that it took in a group of children that we followed and they were unique encounters, PIVC insertion attempts in 266 children over a 6-week range of time showed that we looked at 0 to greater than 9 attempts in this 266 children. 19% of them required more than 3 or more attempts to get the IV in. So that was very concerning to us. And then we did a major intervention program, and then after that post-assessment data, we again tell you how long we waited, 9 months. We found the extravasation rate went from 32% to 4% using a point prevalence assessment. And then very exciting, PIVC insertion attempts also reduced following this education and guideline implementation. Only 1% of PIVC insertions required more than 3 attempts after this education and practice change. And all of that went into 88 words. So you can see we've told you a lot of rich data of pre and post and the great impact this peripheral intravenous catheter guideline really had on this site. And kudos to the Malawi people who were the ones that did this. So then what happens? So you feel really good about your introduction. You got your methods exact. You got your results exact. One, you probably have no words left. So you've got to start thinking about what am I going to edit above? But don't worry about that until you get some words down with conclusions. And the conclusions really, again, go back to what was the aim of your study? What was your title? And make sure you don't add anything new in it. Keep it to that. Are they clear? Do they support the results presented? If you have time, you could put something in about key study limitations, but I think more appropriately is what implications for care or practice or education did you find? And so your conclusion, I usually think 60, if your introduction and your conclusion, are about 60 words or so, you've got a lot of words for your methods and your results. So you can do a nice conclusion. Here's the conclusion for the quality improvement development of a pediatric palliative care assessment tool. The need for a culturally sensitive PPC, and a word about abbreviations right now is don't use too many. If you have 5 or 6 abbreviations in one 300-word essay, you have too many. So maybe 1 to 2. Pediatric palliative care, if we're saying it a lot, takes up 3 words each time. So we chose to use PPC as an abbreviation, but not many. I don't think anything else. So it's crucial to promoting excellence in palliative care around the globe. The Delphi method, so we told you what method we use, was an effective tool to develop a consensus on a PPC assessment tool to use with children and their families in sub-Saharan Africa. This standardized approach will focus on symptom assessment and improve the quality of care for children and their families at the end of life. We could probably tease that down to even less than 70, maybe 60 words, but keep your conclusion concise. Say something that's really important, but don't spend 100 words on it because you need those words for the meat, your methods, and your results. So before we open to questions, here's some kind of advice over the years of writing hundreds and hundreds and reading many, many of your abstracts is the do's. Do comply. Don't be so creative that you think, oh, surely they don't mean to do this. Comply to the instructions. SIOP has beautiful, concise instructions. Spend time with those. Be concise, be clear, be clean. Make sure, again, go back to the title, make sure what you're saying in the other sections mirror the title. Make sure your introduction only has things in your methods and your results. Read aloud, and many of the people that I work with know I read aloud everything. And so read it aloud because you will pick things up that you'll say, oh my goodness, I shouldn't have said that. Have others review, and again, we edit, 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 and review. I always have people that aren't even medical people read it and say, what was I trying to say? Did I say it? Because sometimes they'll say, I don't understand it at all. And when you're, as a reviewer, keep this in mind, and reviewing 30 and 40 abstracts, you got to have something that readily makes sense. And so make sure it's as concise as possible and clear. And then edit, edit, edit. Don't write at once and think it's going to be good. Even seasoned, I think the best seasoned authors edit, 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 edit. The don'ts. Beware of using questions. Questions are kind of cool if you're presenting or you're doing something, that is an oral presentation. But think about it. It takes up 10 to 12 words to ask a question, and the question doesn't really help you in what did you do and what results did you find in your abstract. So don't use jargon. Because people will not understand it. Don't repeat anything. So if you put the aim of the study in your intro, don't put it again in your methods. Tell us what you did. As I told you before, use limited abbreviations, and then refrain from broad statements. Try to be really concise, because they don't really help you in your evaluation to say, children, it's terrible to have cancer in a child. We know that. So make it more meaty, so that you really have the don'ts, like focused on much more specifics than that. I'm going to stop. I will. Let me go ahead with this in case anybody has to get off early. We want to make sure you know abstract submissions are open. They're welcome by anyone. You do, and SIOP members save up to €300 on Congress registration rates. I think you also have to be members to submit an abstract. And so you see again, there's the abstract, the SIOP Congress site. And then the other thing is renew your membership. Make sure that you get on. If you're not active members, I think you have to be on this call, but make sure you renew your membership. Um, and you can save if you go through 2 years, and those are the details for that. So join SIOP nursing if you have it, or if you have friends that need to, and make sure that you do hopefully register for Congress as well. So I'm going to stop there. I think we have a few things in chat. You can open up um, Lori Linder says, my favorite description of the title is to make it an abstract of the abstract. Back to what I'm saying is you better have it can really match throughout your whole thing, because we will take points off if there isn't clear matching. Lori also says, I reviewed many, many abstracts over the years. I can't emphasize enough how important the methods and the results section are. Thank you, Lori, again. I have tried to really emphasize that. Give us some meat because we'll want to. For mixed methods, Courtney has another great advice. Make sure you show how quantitative and qualitative are integrated. If there's not a statement in methods and results about that, call it multiple methods and describe quantitative and qualitative methods finding separately. So if you say mixed methods, you got to show how they mix, is what she's saying. If you've used both separately, then you can say that. It's hard again with 75, 80 words, so you're going to have to do a lot of chopping, but just need to make sure that we do that. Let me see else. Here's another one. We've got great leaders on here. So Lori says, another one of the common areas I see in abstracts is too much content. Yes, in the introduction and not enough. That's why I emphasize over and over 50 to 60 words intro, 50 to 60 words conclusion. You got 200 words left then to do really good stuff with methods. Just, if you're doing a mixed one, then look at what Courtney's saying. You can do that in 100 words. So we're going to close soon because they do have another meeting. We have about 3 or 4 minutes, I think. So anything else? Anybody want to open up on mic before we do close? We're excited about getting so many, I hope, awesome abstracts this year for SIOP Amsterdam. But let me see if anybody else, either in chat or open up to mics. We want to have this time for you to have questions.
Marilyn, this is Lori. Are you able to hear
Yes.
me?
Yes, welcome.
Oh, I'm in the car. I'm in the car. Woo. Yes, I think I'll add again with my comment about the title. As a reviewer, when I read a title of an abstract, I like to have it tell me exactly what I'm going to be reading as I read that abstract. So write a really focused title so that we know kind of what your population is, what it was you were investigating, or what your project was about. And then I want to be able to go to the introduction, and you've told me exactly in the title what I'm going to be reading.
Yeah, thank you, Lori, for that. Thank you. Courtney, I'm going to hand it over to you because I know we have to get off a little bit early. I'm going to hand it over to you, and then I suggest you let them know if they have questions. And if they're not a scholar, the scholars will go right to their mentors, but who they should contact if they have more questions on abstracts. So welcome, Courtney.
Thank you
I
so much,
forgot, guys.
Marilyn.
I forgot to turn on my camera all that time, so sorry about that.
Oh, thank you. No, it was fantastic. I'll turn on my video even though I haven't really gotten ready for the day. But this was so great. I learned things new, and I have been writing abstracts for a long time, and reviewer of these abstracts. So it was really helpful, fresh perspective. Thank you so much. I really like the diagram where you're talking about the madman and writing. That's something I personally don't do well. I'm such a perfectionist. I try and put it in my little architecture boxes right away. But that's such a great idea. Just get your thoughts out there. I did want to mention as well, kind of piggybacking off of what Lori had said, what I look for when I review abstracts is the invisible line. So I'm looking for the invisible line that ties everything together. If you talked about it in one section, you're talking about it in another. And does it align with your overarching goal, the purpose of what you said you're going to do, and your methods? Did you use the appropriate methods to answer that question or to answer that objective? And then your results, you use the appropriate analyses for your methods, and you speak to each one. Don't go beyond, as Marilyn said in your conclusion, don't bring in new information, but everything else within it has to align too. So if you're using quantitative methods, make sure you speak to it through quantitative results. Same with the qualitative. You use a qualitative patient and family satisfaction open-ended question survey for education, then in your results you speak to that as well. The most common topics or themes, example for the satisfaction of patients and families, what they'd like is such and such. So you're just tying it in. Remember, you're using that invisible line.
And Courtney, as we close, who should they contact if they want advice or support within the SIOP network now?
Yeah, no, great question. So I would say first and foremost, start with Joanne and Shelby, since this is, offered through the care working group, and then they can filter you to the right people.
Great. And I certainly with all of our scholars, we have mentors already matched with them working on their abstracts. But anybody else, feel free to, reach out to me too. I certainly can be a support as well. But we really thank all of you. We've had a great group on today. I think we better get off because I know they're using this Zoom for another session. But do reach out to us if you have any more questions or comments. And we just can't wait to see all of your abstracts. We think it's going to be a good year for abstracts. So.
Yeah.
Thanks,
Yes,
everybody.
I put my emails in the chat too. I'm happy to edit.
Wonderful.
And provide advice.
Great. Thanks, Lori. That's awesome. All right, everybody. Take care and happy writing.
Oh, and also a plug. Abstracts due April 1st, but so is the Nursing Leadership Award nomination. So if you would like to nominate someone for the SIOP Nursing Leadership Award, please do so.
Thanks, everybody. Bye.
Bye.
Bye, bye.
Hi, Obadiah.